Well, let's talk next more specifically about the PPAC Obamacare law. So perhaps you can review it. What does it mean as it relates to Medicaid and Medicare? If you can give a little summary of what this means, and then we'll talk about whether it's going to go forward. Even if President Obama is elected, will it work with the Supreme Court ruling?
Yeah. Well, so kind of outline the key changes in coverage on the Medicaid side, which will probably drive the rest of the changes that we're discussing here, because when you have that many more people and that much more money at stake, a lot of the other pieces of it I think will have to come to the fore. But we're talking about a major expansion to adults who typically haven't been eligible before, low-income adults who don't meet those categories of eligibility. And the Supreme Court ruling was, I think, a fairly surprising to pretty much everyone in the policy community on both sides of the aisle. I don't think anyone really saw the Medicaid piece as the part that was going to be up in the air. And so because of that, the law really didn't craft any sort of safety net for this scenario, which is that we have coverage options up to 400% of the poverty level through the health insurance exchanges, which is as big, if not a bigger part of the coverage expansion as the Medicaid part. But for those under 100% of poverty, the law does not allow them to qualify for these exchange subsidies. Okay. So essentially what you might have is, in however many states choose not to expand Medicaid under the ACA, that we have coverage options with subsidies for tax credits for people above 100% of poverty, and those who are below the poverty rate in these states have nothing. And so it creates this odd and certainly to me a disturbing potential disparity that will have enhanced coverage options across most populations in most states except the poorest in a handful of states. So that's the part that we haven't seen play out.
Financially, why would a state not want to opt in? Isn't the federal government, as part of the ACA, giving them money? So financially, why wouldn't?
This is the fundamental difference between cheap Republicans like me and that, because the argument from a lot of Democrats is, this is free money. Right. How the hell can you not take free money? And the argument from Rick Scott, it's an old friend of mine,
but it's a trick because the money goes away.
No, but it's not free money, it's taxpayer money. Okay. And somebody's paying for it, whether you're a Floridian or somebody else.
But also, doesn't it expire? It's only free money for a few years?
It's 90%.
It's 100%. So yeah, the federal government pays 100% of the costs for new eligibles through 2016, and then it starts to phase out and settles at 90%, right, which is much higher than the traditional Medicaid match rate.
It's still a hell of a deal for the states, but the issue is, I mean, for a Tea Party guy, for Rick Perry or
so
Rick
it's more
Scott
of a global Tea Party issue.
We have a $1.2 trillion budget deficit. This is not free money, taxpayers deferred.
The states themselves won't be really financially crimped if they accept and opt in.
No. Okay. And I think what you'll find is if President Obama gets reelected, most Southern governors who are philosophically against this as far as just a pure budget deficit problem will gradually and slowly cave and come around, most likely, because the other states around will get the money and their constituents will complain and their hospitals will complain. It'll take a few years, but they'll eventually probably take it. If Romney gets elected, it's a totally different thing.
Yeah, no, I agree. I think as we're talking about the Affordable Care Act, and one of the sort of subtleties in there that's related to Medicaid is this payment to primary care physicians is going to go up to 100% of what they get for their Medicare patients for some number of years.
2 years.
2 years. And a lot of hospitals are sort of up in arms of how to do that payment change, and then what's going to happen at the end of those 2 years. And if that goes away,
they're all going to scream it's a cut at the end of 2 years.
Is that going to become the next doc fix? Is that going to, there's a really interesting issue here, because I think the framers of the ACA Obamacare were trying to do the right thing. Primary care docs don't make a lot of money seeing Medicaid patients. It's a hard business to see a Medicaid patient. So getting it to parity with Medicare is probably a good thing. Now, having it go away is a really bad thing.
But this causes all kinds of weird things. So if you go in an emergency room, when this kicks in next year, if you're a primary care physician, a lot of them are. They're not ER-trained docs, they're primary care physicians. So you're a primary care physician, you're going to get paid Medicare rates, sometimes 50, 60% more. The guy next to you is trained as an ER doc, and that's a specialty, he doesn't get paid more. So every ER in the country is going to start hiring primary care docs, and not people who actually are trained as emergency physicians, because they get paid differently. So it was well-intentioned, but there's all kinds of wacky implications from this thing. And then at the end of 2 years, they're going to say, well, this is a temporary bump. We're going to pay all these primary care physicians twice as much, and at the end of the 2 years, that goes away. Do you think all those guys are going to say, oh, thank you for the 2 years? They're going to go nuts saying, you just cut me.
But government really can never take anything away. Once you give it, I mean, the doctor fix is never going away.
That's why we collect $2.4 trillion and spend $3.6.
But against that $1.2 trillion figure, I think it is worth remembering what we're talking on the federal side here, that this is not chump change by any means, but the Medicaid expansion and Obamacare are not driving the deficit that we currently have structurally, right? The long-term issue is the overall healthcare expenditures in Medicare and Social Security, along with
I'm a fan of universal coverage, I've been for years. My problem with the President Obama's plan is 400% of poverty, which, with all due respect, a lot of my Democrats can throw around as if it's not a big deal. 400% of poverty is 62% of Americans. That's $94,000 a year for a family of four. That's the number. So you go out, New York, that may be a lot, but in Iowa, that's 62% of Americans to have them subsidized health care through exchanges. I like the exchanges. What they did is they went way overboard. They expanded Medicaid, in my opinion, too much, too fast. They have much money going to the exchanges. A scaled back version of this would have been way less controversial. They're trying to do the right thing, but like most people on my Democratic friends, they get carried away, and when you got a giant deficit, this is the single biggest factor. And if President Obama gets reelected, I believe this thing will be delayed anyway, purely for budget reasons, for a year or so. And if Romney gets elected, it'll probably, I don't know if they'll repeal it, but they'll delay it for a decade.
But how can this be the driving factor when CBO scores repealing the ACA is adding to the deficit?
Because that's such a silly thing. You don't want to get into that. Normally, all the cuts that paid for the president's bill, all the tax increases, all the Medicare cuts, all the Medicaid cuts, I spent years at OMB, would have been used for deficit reduction. If you would look at Bill Clinton, he did in 1997, what I did with George Bush I in 1990. Lots of Medicare cuts and revenue increases. We did it to reduce the deficit. President Obama took those same things and used it to pay for his plan. So he paid for it with all these things that normally go into deficit reduction. So the deficit didn't go down. So if you repeal all the taxes they raised last year and repealed all the Medicare and Medicaid cuts they used to finance this, theoretically the deficit would go up. But that's not going to happen.
Right. But the law as a whole, if you take the whole law away, right? If it never passed, the deficit's
so if
high.
I raised your tax and doubled them and I went and bought a car for being American, I repealed that. If I raised more taxes I paid to buy you a car and repealed it, theoretically the deficit might be higher. That's a silly argument.
Let me change the topic a little bit.